Welcome to the deep dive. Okay, today we're jumping into a real long-running debate in the health world. Fish oil supplements.
Right. For years, decades really, the big clinical studies just dismissed them, so they didn't do much.
Exactly, but now there's this, well, potentially game-changing study, and it's a big but, only for a very specific group of patients.
And that's our mission here. We
Yeah.
want to unpack this controversy. Is this new research the real deal, a breakthrough? Or is it maybe, kind of scientific red herring?
A red herring. Yeah, we'll get into what that means. But understanding this whole thing is, I think, a great way to see how science actually works, the debates, the skepticism.
Absolutely. It's all about critical thinking. So let's set the scene first. The history here is pretty clear, wasn't it?
Oh, yeah. Very skeptical. There was that big commentary back in 2018, I think it was JAMA,
Mm-hmm.
and it basically summed it up. Loads of people take fish oil, but the trials, they pretty much kept nothing. No real health benefit from the supplements.
And the key distinction everyone made was between omega-3s from food, like eating actual fish.
Right. Salmon, sardines, that kind of thing. Seen as, full of vitality.
Exactly. Versus omega-3s from pills, the supplements. Those were often seen, scientifically speaking, as sort of near death. Like the processing killed whatever benefit was there.
Okay, so that's the background. Decades of meh results for pills, which makes this new study, well, quite a shock.
It really is. So fast forward to 2025. A study appears in the New England Journal of Medicine. Very prestigious.
And crucially, it's not looking at the general population. It's focused specifically on patients getting maintenance hemodialysis.
People colloquially call it wash kidney treatment. Yeah.
A very specific group. What did they find?
Okay, so they had 228 patients, pretty decent size.
Right.
And the treatment group got a specific, fairly high dose, 1.6 grams of EPA and zero point 0.8 grams of DHA daily.
And the outcome.
Well, this is the kicker. The fish oil group had way fewer cardiovascular events. We're talking 20.8% experienced at least one event.
Okay. And the placebo group.
33.7%. That's a huge difference, like almost a 13-point drop.
Wow, 13 points in that kind of high-risk group. That is dramatic. So why wasn't everyone just celebrating? Why the immediate pushback?
Because, well, extraordinary claims need extraordinary evidence, right? Especially when it flies in the face of so much previous research.
Ah, okay.
So the journal itself published an editorial right alongside this study. And the title says it all. Fish oil for patients receiving hemodialysis, red herring, or great catch.
Right, the red herring. So explain that again. It's like a distraction.
Exactly. It comes from apparently using strong-smelling smoked fish to train hunting dogs to try and divert them off the real scent. So the idea is this positive result might be misleading us.
Gotcha. So the editorial authors, who were they? McCausland and Curtin.
Yep. They basically asked, how can we get such a, quote, dramatic result here when basically nothing else has worked this well for these patients, and fish oil itself failed in so many other groups?
It sounds like healthy skepticism.
Very healthy. They pointed out that history is full of these amazing early findings that just fizzle out. They couldn't be replicated.
So they're urging caution. Don't just accept these astonishing results as gospel. Stop and think.
Precisely. It's a call for critical thinking. Maybe there's something unique about these patients. Maybe the dialysis itself creates an environment where this specific fish oil formulation works.
So it's all about context, then. It might not be that fish oil is suddenly magic, but maybe it's magic for this specific situation.
That seems to be the cautious interpretation, yeah. And this need for caution, it's kind of amplified when you look outside clinical trials.
Oh, so?
Well, think about the supplements people actually buy. A study in 2023, again in JAMA, found most fish oil supplements sold in the U.S. make health claims, these sort of vague structure function claims.
Like supports heart health.
Exactly. But they often lack solid proof, real efficacy data behind those claims. So being critical helps you, the consumer, avoid jumping on bandwagons based on maybe preliminary or misleading findings.
Okay, so wrapping this up for you listening, we're left with this real tension, aren't we?
Definitely. On one side, you have this really promising new study, but it's just one study in one very specific population.
And on the other side, decades of studies showing no benefit, plus immediate, strong skepticism from experts in the field.
The real test now isn't just this one result, it's replication. Can other independent teams get the same results with the same specific dose in the same dialysis patient population?
So is it a great catch or a red herring? We don't know yet.
Not for sure. And that's the big takeaway, really. Science isn't just about discovery. It's about confirmation, context, and replication. What works in one very specific scenario might not work anywhere else.
So the question for you to think about is what level of proof, what kind of further studies would actually convince the scientific community that this is a great catch for these specific patients?
Yeah, what would it take to overcome decades of doubt? That's where the real scientific process happens.